Hello, I am Ari Sajedi, leader of the Libertarian Youth Bloc, and I'd like to talk to you today about LYBerty's proposed healthcare reforms for Canada. It's become quite obvious that the healthcare system in Canada needs change. A lack of doctors and inadequately long wait times for crucial medical surgeries do not add up to an adequate system for our citizens. It's an infringement of every Canadian citizen's right to life. There should no longer be people waiting in pain or dying because the government is unable to properly manage our healthcare. LYBerty's proposed healthcare reform would completely transform the Canadian healthcare system to ensure proper and timely healthcare service to all Canadian citizens, no matter their income. If elected, we would allow the creation of alternative private clinics, while simultaneously creating a government-backed insurance fund to ensure all Canadian citizens had access to these alternative clinics. Individuals below a certain income would have all the medical costs paid for by the government, while as one's income increased, the government would pay a proportionally smaller percentage of the medical costs. This is not a two-tiered healthcare system because it would be accessible to all Canadian citizens. Rather, it would be a regulatory mechanism for our current healthcare system, ensuring that citizens in areas lacking proper doctors, funding, or services get the care they need. It would also help the government observe the problems with the healthcare system. It would help set an adequate wage for doctors and nurses. It would help show what procedures are lacking in number in Canada. This change would allow the government to properly address the problems with our current healthcare system. We would also work with our colleagues in the House on less extensive legislation to temporarily ease the tension in the current healthcare system. Firstly, we would overturn the ban on organs from homosexual individuals because it's based more so on a discriminatory bias than actual scientific rationality. Secondly, we would increase funding for healthcare service because the cost of our lives is priceless, and the government, if it's to be controlling healthcare services, should not be playing with our lives in order to reduce our taxes. And finally, we would like to work with individuals to create a systematic method to recognize foreign medical diplomas, because it is outrageous that individuals of foreign nationalities with perfectly good credentials are not allowed to practice their profession that we currently need so badly. The healthcare system is a vitally important part of all our lives and is not to be taken lightly. Allowing the government to have sole control of it has proven detrimental, as politicians take a long time to identify a problem and an even longer time to fix that problem. Our reforms would empower every Canadian individual with the ability to choose the vital services that they so need. It would create a fast, efficient healthcare system that would be easily affordable for all Canadians. And this is exactly what Canadians want. A proper healthcare system that is open to all individuals, no matter their income. We will bring it to you. Thank you very much.